So what is health information exchange? Okay, health information exchange is electronic sharing of health related information among the healthcare organization like provider, hospitals, labs, pharmacies, and payers according to the nationally recognized standards. Okay, so nothing, whatever the service provided by the provider to the patient, and that will be shared in a different specialties or different verticals for the reimbursement purpose. Okay, the main purpose, ensure the right patient information is available to the right provider at the right time. Okay, so starting from the demography till the entire service, whatever they're providing, when they sharing those health informations, that will come under HIE, and that is the main purpose of this HIE. Okay, so here they mainly focus. So I was generally telling you, when it comes for HIE, they mainly focus on patient demography. Why? Because the services, same type of services will be provided to the different patients. If you are not exactly taking their patient informations and putting in and exchanging and combining with the services whatever you provided, definitely you'll end up with the confusions and the reimbursement, everything will get collapsed. Okay, so that is one of the main reason this health information exchange has become very important for exchanging the health related information among the different entities. Okay, so why HIE is important? Okay, so improves the care coordination, reduces the duplicate tests and procedures, yes, enhances the patient safety, exactly, then supports public health reporting, increases the coding and billing accuracy, enables value-based care, which is like the much you pay, the much you will be taken care. That is what enables value-based care. So improves the care coordination. So we can coordinate from the pathology department to surgery department to radiology department. Like that, you will have that correlation. And the second is like duplication. So you will not do the repeated test or repeated procedures so that you can avoid a duplication. Then next is like patient safety. Yes, so this will ensure like the patient is under the control, is maintained, all the checkpoints are getting followed. So we are not losing any of these documentations or details so that he is not getting untreated. Okay, then so supports public health reporting. Yes, in the end of the day, this data will be generated and it will be stored. That will help the different entities like CMS, WHO to track down what are the existing diseases or what are the diseases getting treated, where I need to allot a budget. All will be taken through with the help of HIE, which is like health information exchange. Then increase the coding and billing accuracy. Yes, it helps in the providing the coding and billing accuracy, enables a value-based care. These are the importance of the health information exchange. Then key components of the health information exchange. Data source. So like EHR, EMR systems, labs, radiology, pharmaceuticals, and claim data. These all are the data source. And interoperable standards. Interoperable standards means so we have, I have the Bluetooth to exchange. I have folder to exchange. I have drive to exchange. I have the email to exchange, right? Our information, how we are communicating, either through the letters or through the WhatsApp or through the Bluetooth, like the different format of the information exchangeable will be there, right? That is how we operate all together. That is what interoperability standards. They use different, these are the different standards like HL7, FHIR, CDA, and DICOM. Okay, DICOM is for especially for the imaging, HLA for to share the EHR informations, and FHIR is for the EMR systems, and CDA for the ICD related and high risk related like HRC related documentation they used to exchange. I exactly don't remember the abbreviations. I'll provide, already I shared you the drive, and that abbreviations is there. Okay, I will try to figure it out. Okay, so I'm not able to recall exactly because there's something, it will come organization imaging something. So you see the abbreviation, don't forget to see the abbreviation. Okay, then master patient index. Okay, correctly matches the patient record across the system. Yes, what service is provided for whom. So that is the master patient index. It will match up whatever service is provided. It has to go to that particular person. We have a separate system for that. That is what patient index. Then record locator service, RLS, identifies where the patient data is stored, where it is stored, and where I can get the access. Okay, this all can be identified with the help of, what is that? With the help of record locator service that will provide you the in detailed information whichever is stored by the healthcare services. Okay, and the next one is the security and what is it? Security and privacy control. Okay, so it will ensures encryption of the documentation, providing the authentication, then audit trials and the timely basis, whatever the complaints audit is there, that will be taken care, and role based across. So based on your authentication, it will provide access to the certain people. Okay, so try to see these descriptions on these interoperable standards. What I remember is like this is HL is health level 7. That is what they call it for. Okay, it is also again all these are exchanging the electronic health data only, and it has a slight format differentiation. Okay, a small format differentiation only will be there. I remember like this what is that, CDA. It will be in the XML format. Okay, you can see in the internet, you will see, right, that page, that format will be there. Fast healthcare interoperable resource. Yes, fast healthcare interoperability resource. That is what FHIR. Health, what is that? Health level 7. HL means health level 7. Then what is the CDA? CDA means clinical documentation architect. Clinical documentation architect, which will be in the HTML format. Okay. Then DICOM, it is recently they have brought into the floor, which is like mostly used for MIPS. Okay, that is quality measurements. They started using this for the imaging. You able to hear me? Where you lost?
Sorry, sir, it got cut. Sorry, sir.
No issues, no issues. Where we missed out? Where it got
A
disconnected?
last slide, sir. Previous slide.
This slide only. In this, which I
This
was.
slide only. Security and privacy controls.
Okay, okay. So in the security and privacy, I'm just repeating it. So in security and privacy, encryption, authentication, audit trials, and role-based access. Okay, these are like a private and security controls, which will be provided for the usually provided by the provided in the health information exchange system. Then these interoperable standards. So just try to see these abbreviations. Okay, health level 7 and what is that? FHIR, fast healthcare interoperable resource. Okay, healthcare interoperable resource, and this is all web based. Okay, modernized and web based one. This is FHIR. Recently they started using. Then clinical documentation architect. This is Excel format, so XML format. Usually this is mostly used in the what is that, in the discharge summaries or progression notes. You will be seeing in this format. And recent improvement on based on the MIPS and images, including images they're bringing it. That is DICOM, digital imaging and communication in the medicine. Okay, digital imaging and communication in the medicine, where they'll be able to store and transmit the information by using the DICOM. Okay, so that is what the key components for the HIE system. Then types of HIE models. Okay, type of HIE models. Try to remember, this is exam favorite. Direct exchange, where provider to provider the exchange will be done. Used for referrals, lab results, discharge summaries. Okay, sending the patient lab to the specialist. Okay, that is what the direct exchange, provider to provider, one specialty to other specialty. Query based exchange, provider searches for the patient data. Okay, now the provider, what he is going to do, he is going to search for the patient information. That is what query based exchange used in the emergency. It is like a doctor retrieves the prior medical history. Okay, in the emergency department, they will check whether this patient is already having any allergy, any other issues. Like that, the information will be there in the health information exchange. There you will be querying and you will be searching. It's like search engine. Then customer mediated exchange, patient controls the data sharing. Uses the patient portal or application, patient downloads and shares the record. Okay, that is what customer mediated exchange. So these are the types of health information exchange. Then common health information exchange organizations, regional organizations, statewide will be there and nationwide will be there, which is like health exchange organization, Commonwealth Health Alliance, Care Quality. These all are the some of the national network organizations. Then HIE and compliance. So even though I'm going to transfer the information, something need to be under the control. Okay, so those is the control we are seeing. So under the IPA, when you're exchanging the information, health information, your PHI will be protected. Minimum necessary rules will be provided. Patient consent requirement is required. Okay, without informing the patient, we cannot change as per the HIPAA. Then HITECH. HITECH will be seeing in detail in the next upcoming presentation. So HITECH-Act, so which will promote the EHR adoption, strengthens the HIPAA enforcement and breach notification requirements. All this will be taken care by the HITECH-Act. Then information blocking rule in 21st century Cure Act. okay, which provides the preventing lawful data sharing and supporting the patient across the record, which means like, see, as I told one example, if the patient is HIV positive, we cannot share it. Okay, so that is the Act, 21st Century Cures Act, which says you cannot share your private lawful data to anybody, which will be blocked, even though it is a health information exchange. Okay, that is what the complaints and HIE, which is health information exchange, stands for. Then relevance to the medical coding and billing, improves the documentation completeness, reduces the coding error, helps to verify the PO indicator, supports the risk adjustment, and facilitates the audit and compliance. These are the medical billing and coding related points. Okay, so that is what it is on the HIE. So we'll see the next topic